Welcome to our Obstetrics series. This video is on small for gestational age. The diagnosis of an infant as being small for gestational age is based on the infant's size at birth, that is, a weight below the 10th percentile. The birth charts can be used to evaluate this. If you like, you can pause the video here to check the average norm values for a viable fetus, both for the crown rump length and for the fetal weight. The condition of being small for gestational age occurs in constitutionally small infants, likely born to small parents, as well as pathologically small infants. Here, several reasons apply. There are placenta-mediated reasons. Primary placental conditions are abnormal placental vessels, chorioangioma, abruptio placentae, and abnormal implantation. Maternal conditions include preeclampsia, severe diabetes, chronic hypertension, smoking, morphine, alcohol, cocaine, and warfarin. Fetal factors include an abnormal number of chromosomes, malformations, congenital infections, insulin resistance, reduced insulin, and insulin-like growth factor 1 production. Prognosis. Constitutionally small infants have no increased risk, but pathologically small infants have an increased morbidity compared to non-SGA infants. 50% of the surviving infants have serious short or long-term morbidity, for example due to meconium aspiration, pneumonia, and metabolic disorders. Pathologically small infants also have an increased mortality compared to non-SGA infants. The mortality rate is 4 to 8 times that of non-SGA infants. Associated issues, according to Nelson Textbook of Pediatrics from 2020, are listed in this table. Please pause the video to take a closer look. Note: intrauterine growth restriction is not the same as when the infant is small for gestational age. The gestational age is based on the size of the infant at birth, while intrauterine growth restriction is a prenatal diagnosis describing a fetus who does not reach in utero growth potential. Therefore, not all infants with IUGR are SGA, and not all infants who are small for gestational age have intrauterine growth restriction. Being small for gestational age is therefore not the same as being of extremely low birth weight, very low birth weight, or low birth weight, although it can coexist in the same infant. But it is important to see that the term small for gestational age takes the gestational age into account, while birth weight merely considers the weight of the infant at birth. This video was part of our Obstetrics series, and it was on small for gestational age.